be on the person's right-hand side. The reason for that is mostly for the heart, because of looking across for any kind of pulsations, I can see at a better tangential angle than straight down like this, okay? So I've done his case history and asking about smoking, any problems.
Smoking while you're giving them a test?
Any kind of out shortness of breath, any kind of lung problems in your family. Do you exercise regularly, et cetera, et cetera. Okay, so I'm looking at the lung area, I'm looking at his chest. Of course, I would have him
I was
shirtless.
about to say, are they going to be gowned?
Yeah, they'll be gowned more.
And you just kind of.
You gotta look at the skin.
Okay.
But we'll just pretend. Okay, so I'm looking at his skin, I don't see any problems. Looking at his fingernails, everything looks good, no signs of cyanosis. So the next thing on a male, I'm just gonna palpate. Tell me if there's any tenderness in any of these areas. Tenderness?
This is like the J pattern, right?
Yeah, J pattern coming out to the midline. Okay. Now, I want you to say 99 in a deep voice.
99, 99, 99, 99, 99, 99.
Good.
That was deep.
That's deep. Okay. All right, so
More retarded than deep.
now I'm going to do percussion. I don't do diaphragmatic on the back because there's no diaphragm on the front. I mean, so you just do diaphragm on the back. So I'm going to percuss. I'm going to just be tapping. Tell me if there's any pain here. But we've already.
You're listening too, right?
Yeah, I'm listening.
Okay. I know. I'm just putting it in my
Yeah,
head.
Completely
because now I'm
ignored.
down here, and so when I go here, listen to what happens. Wait. There you go. Gastric air bubble, and then listen to the liver versus lung.
Perfect.
Liver. The gastric air bubble's low.
Air bubbles.
Okay, so that's percussion. And really, I'm not going to get good comparative sounds on the front because his heart's here. So I'm going to hear thuddy versus not much different, but the heart is here, supposedly. Listen to your breath sounds. I want you to breathe just a little bit deeper than usual. Don't here. I got my stethoscope. Oh, it's up there. Here. Again, it's, every other interspace, just make sure. And again, we're only coming down here. And we want to make sure we're coming out to the sides, because here's the pec area. This is about interspace 5, 6, and so this is pretty much as far down as the lungs will be.
You go side to side.
Yeah, and again, you want to go side to side to compare at the interspace, same as the back, always side to side. The diaphragm only. Think about the lungs. What does the lungs have to make your lungs go up and down?
Yeah.
Diaphragm. So use the diaphragm with the stethoscope. Heart is blood, so you go bell and diaphragm.
Can we see
For the
the?
heart valves. Everywhere else, with like the renal arteries, where's your umbilicus? Right here. If your renal arteries are going to be up a little bit, the iliacs will be down here. And so when you do those, you want to make sure that you're always listening with the bell for the renal and the iliac.
And the aorta, right?
And the aorta. Yeah, and the aorta will be slightly off to the left of midline. In most people, it's just, here's midline, here's his umbilicus. It's going to be usually slightly over here.
Is that whole exam?
Yeah.
Whole patient percussion?
Actually, the only thing that really has to be on skin has to be inspection and instrumentation. As long as they have a thin t-shirt or a gown, you can percuss and palpate over it, but you've got to look at their belly or wherever you're looking at on skin, okay? And you always have to do the stethoscope on skin. Other than that, really, when you do the tape measure, you want to really have it over the gown anyhow, because they don't get sweat under their armpits and clean it off. Well, yeah, think about it,
Ask your question.
Can you show the 5 points of the heart, please?
Yeah. Okay, here's the notch. Here's the angle of Louis. You got a great angle of Louis.
I know, it's phenomenal.
So here would be the second intercostal space, aortic. Right from the angle of Louis. Come right off. You can.
Oh, wow, yeah.
Ah! It's just like high school.
The aortic. Then we're going to go pulmonic, and then you can actually come down one. There's herbs,
No, that was J.
fourth and fifth. The aortic, tricuspid will be right here, and then we're just going to follow it along. You can feel it, and there's the mitral right there. And usually it's pretty much on the contour of the pec.
So
So
it's
here's his pec. I can feel his pec. It's pretty much right there.
Second intercostal
2,
space.
2,
3,
3,
5, 5.
5, 5.
And but 5-5 goes out on an
Right,
angle
right,
because of the
right.
angle of the ribs. That's where we say everybody's valve should be. It could vary a little bit, but usually you come out with the angle, and it is far down.
Yeah, it is.
And people wanna start up here.
So, aortic, pulmonary, herbs, tricuspid, mitral.
Remember pet monkey.
sorry.
A-P-E-T-M.
Right.
Herbs, tricuspid, mitral.
Yeah, P-E-T.
Aortic,
PAET.
no. A pet.
A pet monkey. I like buffalo for bicuspid, a pet boy.
APET, yeah, that's right.
Ryan, your pet boy.
A pet boy. Hey, pet boy.
Thank you.
Find a scapula, I just basically come like this and have a good tissue pull.
Okay.
And my thumbs are almost parallel with the spine and have them take 3 deep breaths in and out. That's respiratory expansion. Can you guys see me?
Right.
Okay, you don't have to, that's okay. So now, here's his inferior tip of scapula, and I want to come out, here's his spine, so I come out somewhere in the middle here. There it is. Okay, so now what I'm going to do is have you take a deep breath in and hold it. Good. Okay, now blow it all the way out. Now it's coming back up, so it should sound really dull again.
Now, are we marking?
No.
I think we did that in the first class we had with you, where we
I
marked
never
how
had you
far
mark.
for
You
a
can,
start.
you can tell it.
I marked Ryan anyway.
You can visualize it. You know, it's like, are you gonna mark every time in your patients?
When you start out, do you have them do anything, like before we even tell them to breathe?
No, you want their arms down for this one, though.
Which one do you want
Any
the arms
motion, think about it, any motion test with the rib cage, respiratory diaphragmatic, you want their arms down.
So palpation and percussion.
Anytime you wanna listen, you want them crossed.
Okay.
Because listening gets the scapula out of the way. So fremitus, we're listening or feeling, we're assessing. Auscultation, we're assessing. Percussion, we're assessing, okay? So I'm gonna have his arms crossed for percussion, fremitus, 99, 99, and then with my stethoscope. Arms down for respiratory and diaphragmatic. So really, again, here we are again, I can do this side for diaphragmatic. I can have him take a deep breath and blow it all the way out first. Blow it all the way out. Okay, now take a deep breath in and hold it. There, okay. So you can do it 2 ways. If, you know, you're taking a deep breath in, the diaphragm should go low, so you should hear hollow sounds lower. When they breathe out, the diaphragm comes up, so all this little block of things should be, sounds like it is below the diaphragm, nice and muscly.
And liver percussion.
On the rib area here, it's usually about 4 to 8 centimeters, so I'm gonna percuss down till I hear the sound. And over here, it's like 8 to 12 centimeters down, so it goes like this kind of a thing. So you can start from the top or the bottom, and so I can start from here. There it is. Okay, so now I would mark that and I can come up here. There it is.
I got you.
Okay?
Gotcha.
And now over here, it's gonna be longer. There it is, and now I'm gonna come up here.
Yeah, well, baby liver, Joe.
Yeah, baby liver. Of course, this is again percussion.
I've been working it out.
You'll notice that when I'm percussing, I'm not, even with diaphragm, I'm not skipping big areas. When you do the diaphragmatic excursion, you want to go small increments, because otherwise you're going to miss it. Sit up again. The biggest thing about getting good percussion sounds, you guys, the biggest thing about getting good percussion sounds is to make sure you're pressing your finger into the skin. So if you've got a heavier person or a muscly person, you really want to press in, but I don't have to on Joe, I'll probably make him black and blue.
If you're doing fremitus, you just basically go here all the way
Yeah,
No
right,
muscle.
to about right here.
right, to T10,
Right. And then if you're doing respiratory, you just put your hands like,
this.
okay, and you have them what, take a deep breath in?
Yeah, take him.
Do you want us to use our fingers or the hammer?
I want you to use your fingers.